Hello, my name is Michael Mosshart. I will be the nurse taking care of KM today. I've came in, I've introduced myself, I've washed my hands, and I'm ready to get started. So the first thing I'm going to ask is, do you have any family history of like skin cancer, skin issues that you know of?
I know my grandpa, he had, I believe it was basal cell carcinoma, and he had several spots removed, but that's the only one that I'm aware of.
Okay. Okay, and then do you go out and tan? Do you use tanning beds? Do you tan outside or anything like that?
I don't use any tanning beds. I generally, like when I'm outside, I try to wear sunscreen. Like when I go to the pool at the park for extended periods of time, is usually when I'll make sure and wear sunscreen.
Okay.
And wear hats. Because my scalp burns really easy, so I always try to wear a hat during the summertime.
Very good. Do you reapply sunscreen like as you throughout, like if you get in the pool, do you reapply when you get out?
Probably not as often as I should. I could definitely improve on that.
Okay. Yeah, if you're, outside working in the yard or outside doing hobbies, sweating, don't forget to reapply during those times too, because you could sweat and then that sunscreen's not as effective then. Make sure and apply, at least SPF 30 or higher to prevent any sort of skin cancer or anything like that. Wearing hats is great. You're protecting your scalp. You're helping to protect your face from the sun as well. And then do you apply sunscreen like year round, or is it just during the summer? Or
it's probably more in like the warmer months, but I would say like halfway through spring to halfway through fall. I don't do as much in the winter.
Okay. Yeah, it's hard to remember in the winter. Not everyone thinks of that as much. I mean, we're out here in northwest Kansas where it's pretty cold, but we still do get exposed to the sun. So just don't forget to, apply during the winter months too, because we're still outside. And so that's all really good. Do you examine your skin at all, like at home?
I mean, probably not not as good maybe as I should, but I have, there's like spots, like if I notice something that I try to keep an eye on a regular basis.
Okay. How often do you examine your skin and what all does that entail?
Well, like I have a spot that's like on my lip right now, and obviously like I look in the mirror multiple times a day, so keeping an eye on that. I see it every day. I also had an area on my back that it's been a while since I've looked at that one. Sometimes I'll if I notice something, I'll have my spouse look on my back, but not super regular do I actually look at it.
Okay. So I just encourage, look at least once a month, if not more frequently. Like once a week wouldn't even be a bad idea. Make sure you're in a well-lit room. You can use, if you have a full body mirror, those are super helpful. And then you can get a little handheld mirror to check your palm, like the bottoms of your feet, behind your ears, just places like that where you might not normally look. You mentioned your back, so having a loved one or family member look at your back, look at some of those areas that you might not normally look at as frequently. That would be really good. But I would suggest at least once a month, if not more often, especially on those spots that you're concerned about. Do you go to the dermatologist at all?
Yeah, I've gone to a dermatologist here in town a couple of times, and I actually have another appointment scheduled for next month.
Okay, well, that's good. Have they removed anything in the past, like any moles or?
I had one spot. It wasn't a mole. They weren't really sure. It was almost like a cystic lesion that was on my back, and they removed that little nodule. Nothing came of it, but that's the only thing.
Okay. So no issues or concerns with that, like the test came back and it was benign and okay. All right. Do you have any questions or concerns today before we get started?
No, I don't think so.
Okay. So next I would just inspect your skin, your color. It's pink, appropriate for ethnicity. There's no abnormal color changes that I can see. Do you have any different pigmentation that you've noticed anywhere?
No, I don't think so.
Okay, and then you mentioned, and then I would assess any moles. So do you have any moles anywhere?
A couple that I know of. I have one one on my chest, one on my abdomen, and then I know one on my back.
Okay, so any moles, larger like moles or anything like that, you would check for asymmetry, border, color, diameter, or revolving. And this is something you can do too. And usually they say it needs to be smaller than a pencil eraser. So if you get like a normal size pencil, and you can kind of monitor it yourself too. So that's always really good. But anything that you notice that is outside of the A, B, C, D, E, what I just went over there, make sure and get a hold of your provider as soon as you can and get those checked. So next, I would palpate the skin. So feel for like temperature, it's warm, her skin's dry, smooth, her skin's thin. It's a little thicker on the palms, but it's still pretty thin, but no swelling or edema. And then you would test for turgor. You can pinch the back of the hand and make sure that the skin rebounds, and hers looks good. So that just checks for dehydration and looks good. Then how often do you like take baths, showers?
Once a day.
Once a day, okay. And skin looks good. There's no, from what I can see, like no sores or anything like that. And then are you having any bruising anywhere that you've noticed?
Not that I have noticed.
Okay. Do you have any sores anywhere?
No, I don't think so.
Okay.
Sometimes. Oh, actually, I guess I have a burn that I'd gotten a couple days ago just cooking.
Okay. Okay. So assess any sores that the patient might have. You're going to assess the color, shape, size, and location of the lesion. And then you're going to inspect and palpate the hair. So I would just inspect like her scalp here, make sure there's no lesions. Have you noticed any like discoloration on your scalp or anything like that? Any sores on your scalp? Hair texture is fine. And then you said your history that you've had some hair thinning.
Mm-hmm.
Do you have any how is your hair distribution? Do you have hair any other places or any?
Yeah, my hair like on my head is thin, and then I've noticed like a little with I've been told with my PCOS that it's common. Like I sometimes have facial hairs like on like my chin and neck or like under my chin.
Okay.
So that's been normal for me for quite some time.
All right. And then so no, the hair distribution's fine, the hair texture's fine. We talked about distribution, there's no lesions, everything looks good with that. Just encourage you to keep wearing hats. I know that they make some spray sunscreen that's kind of good for your scalp too, so that would be just keep that in mind to protect your scalp from the sun. And then the nails, you just look, toenails, nails, both of them, inspect the shape. So her shape is normal, there's no clubbing. And then there's no deformities or anything like that. It's a consistent shape. And then they're clear, her nails are clear, and the color is pink, the nail beds are pink. And then you would assess for capillary refill, which it needs to be less than 3 seconds, which it's brisk, comes back right away. So, and then let's see. What questions do you have for me today?
I don't think anything.
Okay, so I'll send you home a pamphlet that goes over the self-examination, some different tips and tricks with that. But if you do see anything that looks, that is changing or anything like that, don't hesitate to give us a call. So, all right, well, thank you for coming in today.